Right. Looks like we're queued. I'm just going to give us a second to see that we have a couple of folks on here with us before we get started and get kicked off. And we do. We already have, it looks like Councilor DeMott, Parker Brown, and Melissa, and one of our board members, Wayne. So we'll go ahead and kick off our weekly program. Today is our mayor message from Mayor Herb Atchison related to COVID-19, all things city has been involved in and doing to help our overall community adapt to the situation and prepare for what's ahead. I am Juliette Abdel, President and CEO of the Westminster Chamber of Commerce, and it's my absolute pleasure to have these weekly with our mayor and with a lot of our other electeds throughout the week, in addition to some of our educational content. So I know we have a pretty robust list of items that our mayor is going to be touching on today. If you have questions or comments as he is going through some of this, please make sure that you comment them in the section of the comment section of this video. If you like what you're hearing, or if you just kind of are feeling great about what we're sharing, please give us a thumbs up so we know that we're doing good, and that you can also share this message on your pages so your following can be just as engaged and informed on what's going on in our community. If you've landed onto our page and this is your first time, you haven't ever seen the Westminster Chamber of Commerce before, please be sure to like the page and follow it, and then follow us on other platforms like our Instagram and Twitter at West East Chamber. So thank you, Brian Head, for also hopping on as well. And I will turn this over to Mayor Atchison to get us started.
Good morning, Julia. As you indicated, we'll probably cover a number of issues that are going on and facing the city right now, but I want to do a little bit of an update on where we're at today as far as the potential for reopening businesses throughout the entire state, not just in Westminster. Westminster is still subject to the stay-at-home order set to expire on May the 9th. We'll have to wait to see if that order will still expire on May the 9th or move to safer-at-home order. In advance of that, what we're asking all of our businesses in Westminster is to make sure to review the industry-specific guidance for their businesses and implement all requirements prior to opening. The last thing we want to do is have someone try to open up and then not be prepared for it and have to shut back down again. Our Economic Development Department is also putting together a checklist of items for business to help them develop their own COVID-19 plan. Again, this is a part of your opening requirements. This plan should be communicated by management to all supervisors and employees on every shift. The plan should include procedures for purchasing and keeping inventory of necessary materials. It should also consider how the precautionary measures will impact workflow. And the checklist will help businesses think about and address some of the following issues before they open. Measures to protect employee health, for example, protective gear and contributing to work remotely if possible. Measures to keep employees and customers and clients at least 6 feet apart. Some of these examples are barriers and markings on floors, setting workstations further apart. Also, measures to prevent unnecessary contact. This is, for example, digital solutions in place of paper, online interactions instead of in-person interactions when possible, and measures to increase sanitation. For example, hand sanitizers available at the entrances of high traffic locations for use by employees and customers. And all payment portals, pens, and styluses are sanitized after each use. Also, measures to prevent crowds from gathering, for example, limiting the number of people inside your store or business, and services by appointment only, no walk-ins or waiting. We are recommending that each business appoint at least one employee to see that the plan is implemented, and most importantly, that it's enforced. We're working very closely with the county health departments and their officials to make sure that we have the correct information and can ensure that businesses can reopen safely once it's deemed for all business to open, and that will be okay. Now, in the meantime, we're going to continue to encourage businesses to visit our city's economic development website, which is westminstereconomicdevelopment.org. You'll find the checklist that I mentioned a minute ago, as well as other tools that will help businesses as they try to recover and maintain business operations during the COVID-19 crisis. And staying with our business for just a second, I know that a lot of people are still interested in what's going on with Westy Rise. We do know that that was open initially for 2 days. We had over 400 applications. And then after that, the staff was going through evaluating each one of those applications. Now, not every application got approved. There were various means of whether they got approved or not, but that's going through the process. I would never recommend telling people publicly why your business didn't get approved, but that's certainly the information you can get for yourself. It's my understanding that we're going to get an update on the study session that's going on at City Hall tonight. So if you're interested in where we're at on that, tune in for the latest tonight during the council study session. This will be part of the COVID updates that we do tonight.
Excellent. And Mayor Atchison, if I can just interrupt for just
Sure.
1 second. So the checklist that our Economic Development Office is putting together, this is guided from some of the state resources that came out. Is that right? Or
Correct. Yes,
okay.
it is.
Yeah.
So there, you won't find two different sets of documents. You'll find information. Some of it may be toned down a little bit, but basically it's there. And as Juliet and I were talking before we went on live, we have some industry specific ones that have state guidelines on what they can do to reopen. And those guidelines are somewhere between 25 and 30 pages long.
Okay.
So it's very important that whoever you appoint in your industry sector has access to those guidelines to make sure you're in full compliance, because even one could make you go back and start all over again. So be very careful, make sure you're well informed of what it is. And if you have questions that the city can advise you on, again, go to the website, westminstereconomicdevelopment.org, and we have ways to ask questions there. And there's a lot of frequently asked questions that are already posted there.
Mm-hmm.
You know, some of the information that's going around, this is not something that everybody looks for. This one is from the Jefferson County. This information I'm giving you right now is from Friday night, close of business. We haven't had the reports yet for today.
Mm-hmm.
On the causes of death, COVID-19 have caused 75 deaths in Jefferson County. Jefferson County coroner is reporting a higher than normal number of caseloads, 50 to 70 more deaths per month year to date outside of COVID-19 cases. So COVID-19 is not the only thing, but can continue to remember we are losing people on a statewide basis. The numbers have been running pretty consistent. We're using 20 plus deaths a day that are contributed just to COVID-19. That doesn't mean that everything else has stopped. Food pantries reported a range of 50 to 400% increase in the number of individuals served weekly in March and in April. On April the 28th of 2020, Jefferson County opened a non-congregative shelter for people experiencing homelessness with confirmed or suspected COVID-19. Unfortunately, Jefferson County does not have a shelter available to high-risk individuals experiencing homelessness who do not have COVID-19. Now, these meetings that are going on between elected officials, committees that are being formed, and again, this is one Juliet and I'll talk, so I'll just take a moment here to do this. In Adams County, last Thursday night, there was a big notice that went out to mayors and others, county commissioners, about a meeting that was going to take place on 7:30 on Friday morning. That was the kickoff to a number of groups that were being organized through the county to help gather data and make recommendations to the health department for upcoming. One of those committees is dealing with businesses, which I sat on. Another one is for vulnerable populations, which one of our council members is on. One with venues and open space use. Another one's communication. And then another one is compliance and return to work. So many of our council members have jobs that are more flexible than others. So those that were flexible with their employer jumped onto some of those committees. Those that have restrictions by their employers, if you're at home working, we want you working at home on our work that we're paying you for, or some are having to go to offices still. So depending upon the situation, some of them picked up some of those committees. We've had several committees meetings. We had another one this morning on the one I'm on. It was running about 2 hours. And these are 2 or 3 meetings, sometimes 2 times a day and sometimes 2 or 3 times a week. But what we're trying to do is establish protocols that we can recommend to our health departments for them to consider as they start to look at reopening. It's my understanding on a call that we were on this morning that Tri-County, which is only the Adams County portion, is planning to give us an update on where they think the orders will be at the close of business on Thursday of this week. Jefferson County has not been running these committees to our knowledge. If they have, they've not been involving the elected officials from Westminster. They may be doing it internal to their own resources. We have not heard anything from Jefferson County Health about when they think they will update the stay-at-home order for Jefferson County.
I have
Go ahead.
an update. Yes. So, and this is where it's been beneficial that city and chamber are kind of working together on this, is you all have been involved in Adams County. Jeffco has involved chambers on their side. So their health department, their idea is to have things released by tomorrow as far as recommendations and things. So that's being developed as well.
Yes, and one of the things that we're trying hard to do is that because Westminster is in a unique position, very much like Arvada and a couple of others around, that we have two health departments to guide us.
Right.
So depending upon which side of Sheridan you live on, you have one set of rules on one, or you have another set of rules on the other. Our big piece is to make sure that the rules for either one are consistent with the other one, so that we're not having one set of stuff on the west side of Sheridan and another on the east. We're trying to get that up to the state level as well, but in many cases, as we see, the state has gone to a safer at home. But the conditions that we see here, both in Adams and Jefferson County, is our numbers are still not going down. They're still increasing. So until the health department sees a plateau of that, no new cases for 14 days is what the state orders are around, and our stay-at-home orders are. I don't anticipate that we're going to see a lot of relaxation until those numbers start to become better. Now, over the past week, even in our council meeting last Monday, we started discussing about enforcement of distancing, face coverings, all these kind of things that we're still having to deal with our stay-at-home order. Right after that meeting, we had another meeting, and I mean, the city officials, myself and Don Tripp were two of the people that were there. We're probably two of the people who are in the most consistent meetings with other county commissioners, mayors, and health department, and these meetings go on multiple times a week. The health departments ask us to give us a position on where does the city stand on some of these issues. A letter was drafted, sent to council, and let me be very clear. This is not a unanimous decision by council. There are different opinions on what we should do or not do. That information was sent to the county health departments in both sides of the city, saying that we are not unanimous in our decision, but here's what the majority has said that we would support. That was a recommendation based upon a request from the county health departments. We have moved on. That is outside of our hands at this point. It is up to the health departments to issue those orders. We'll see what guidance they give us back, hopefully this week, because we want to get information out to our businesses before waiting till the day before. But again, we don't control that release of information or that guidance. We have input. What they accept, what they don't accept is up to them.
And the recording of the last meeting where a lot of this discussion took place on council is available on our City of Westminster's YouTube account. So if anybody is interested in hearing more about how that transpired and everything, you can find that on the website, on the YouTube account, and also on the City of Westminster's website as well.
One of the things too that we'll talk about today on this call is we've already seen municipalities around the state starting to take orders outside of what the counties are requiring. Excuse me. So in the event, if you look around the metro area, Wheat Ridge 2 weeks ago put a order in place for their city of all people entering into critical businesses had to have face coverings. And we want to emphasize people wearing face coverings versus the word of mask. Mask indicates to some people that it's the mask that doctors and stuff wear when they're dealing with patients, are the N95s. That is not what these recommendations are related to. They're talking about the ones that you use a bandana, a scarf, or homemade mask, and as a face covering. It is not a protective mask in that sense. We have already seen several municipalities go into a mode of mandating this, going into these critical business. Wheat Ridge was the very first one. Lone Tree, Denver, Boulder have now joined on the call that we had on Thursday with the mayors from around the metro area. Longmont, Superior, Louisville, Lafayette, and Lone Tree's already going in, and about 4 others are in the process of adopting resolutions to make the coverings on your face going into critical business as mandated effective immediately with those cities. Whether or not the county health departments goes ahead and issues that as a mandate for all cities within the control they have is still be the same. But one of the things that we've seen some information come back on is, and this has really started down in Douglas County. When this first came up, there was a lot of confusion about what control a health department does or it doesn't have. Most of it was focused at the executive directors for those health departments. So make sure people understand that the executive directors are not making these decisions as a single individual. The health department directors are appointed by a board of directors or a board of health. Most all of the board of health are appointed by county commissioners. In the case of Tri-County, Adams, Arapahoe, and Douglas all have a certain number of people representing their county on the board of health. Jefferson County appoints theirs. The one that's here in our neighborhood that's a little bit different is Broomfield. Broomfield being a city and county, their city council actually holds the same position as the Board of Health. Now, they very likely have others who advise them on the technical aspects of what they're making the decision on, but they are the voting members. So I know there's been a lot of disparity thrown at Mark Johnson and John Douglas as being the face of the health departments because they're the ones who are signing off on the order. But believe me, they don't make those in an individual basis. All of those decisions on closing, not closing, what level they go to has to be run through the Board of Health for their respective communities. And then the board is the one that directs them to implement that direction.
And I like that you've kind of shared the hierarchy with everyone that's tuned in as well. I don't want to lose sight. I know you have a lot on your list, but we're getting a lot of questions, so I don't want to get too behind. We're going to try and manage both. We have Counselor Smith. It looks like Counselor Seymour is also on here. Hello, Tina and Richard Hawkins. Thank you for coming on and tuning in. We have, so Brian Head says he lives near Highland Hills Golf Course on Sheridan and noticed that they have opened already. Have the Parks Department been in touch with them to share best practices for reopening our courses?
I know it's from our Parks and Rec department. They are in communication with all of the Park and Rec districts and departments around the metro area. And they are sharing information, but we have still not made a final decision, which will come through the city staff. That will be a decision that the city manager makes. Once the staff has confirmed that they believe they can open it safely and not infect anyone, that they have the ability to do that, and that we have enough foresight to get it open on a safe basis. I know that some of the other golf courses in the area are open, but they are also limited. Golf carts are not available. The golf shops are not open. The restaurants at those facilities are not open. Everything has to be done online and all payments have to be done online. Still, there's still the issue of people complying with the safe distancing. Now, you would think most people could safe distance, but we still see the issue even around some of our areas. I feel the call on Sunday of a car show going on. Don't know why, but we were required to report it to our PD and stuff, so we made the call. PD went by, and I think everything got taken care of.
Wow. Hi, Jessica. Thank you for tuning in. Parker shared he's also has some checklists on restaurants, and all the checklists, you know, we'll be compiling it and putting it on our website. I know it's on Westminster Economic Development as well, and we'll cross-reference those whenever we push out a lot of our email communication. So thank you for sharing that. It looks like Councillor DeMott is asking, how is Westminster participating? How did you pick the selections, as he's just now hearing about this? It seems like it was not shared. Okay, so I think he's referencing Adams County, the groups that were available for participation.
That information was shared by email from me to all the council.
Thank you. And then here's another a comment, looks like also a question. During a previous city council meeting, it was noted that we had a few police officers and firefighters in quarantine after being exposed to COVID-19. Do you have an update? Does the mayor have an update on that?
To my knowledge, we do not have any members of our first responders that have been determined to have COVID-19. If there were people who were exposed, they may have been tested, but I don't have the day-to-day level of detail on that. I'll ask about it tonight when we're on the study session, though.
Yeah. And then one last question, then I'll have you kind of continue through. I think I'm giving you a break too, so you can rest your. This is from Kaylee Kensel. She says, it sounds like you anticipate an extension of the stay-at-home order in the Tri-County area based on the number of positive cases. Is that correct?
What I would tell you is that based on the information that we have from the health departments, they are still seriously looking at what the infection rates are, what the test results are that they are having. But I can't tell you one way or the other. We have not had a decision made by the health department or even a recommendation back beyond where we're at with May 9th. That decision should be coming out this week. We've provided whatever input we could, but again, they have access to the data that we don't.
Okay. I think that's all the questions for right now. So if you want to continue with our list, if you're just now hopping on, if you have comments or questions, please type them into the comment section so we can get our mayor to at least answer them or come back and answer them at a later point for us.
Just a couple of things. I want to go to the stimulus materials that we've been talking about. The CARES Act funds have been released down to the states. On our agenda tonight is an intergovernmental agreement with Adams County on how the money that was brought into the county is going to be distributed and what portion of that will be offered to the city of Westminster. So we will be reviewing that tonight in our council meeting that we'll have prior to the study session. We will expect to see an IGA similar to that coming from Jefferson County sometime possibly later this week. So as the CARES Act comes back down to the counties and the states, depending upon how the counties decide to propose to the municipalities to split that money up, we're anticipating, at least within Westminster, that we will get some funds both from Adams and Jefferson. That money will go to help pay for the impact that we've had from the coronavirus and the impact of additional work, overflow, testing, everything you can think of. We have kept meticulous records on what money is being spent on the COVID-19 response so that we have a way to justify getting reimbursements through the CARES Act. Now, the other one I would caution people to look at, and this is very much in regards to our state budget. The state right now is anticipating a $3 billion with a B dollar shortfall in the general revenue. And if you'll bear with me for a second, I want to read a quote from our Speaker of the House, Casey Becker, that was out just yesterday, but I'm only going to read the first two paragraphs. This is from Casey Becker, Speaker of the House, and I quote, "A warning. What I'm going to share is not pretty or reassuring. If Colorado doesn't get more federal assistance for our state and local governments, we could see schools, law enforcement, health clinics, correctional facilities, and job training programs shut down or stop functioning. Seniors on Medicaid may lose dental care. Literacy, suicide, and bullying prevention and homeless veteran programs may be cut. We may eliminate or narrow many infrastructure projects, including road, school, and university maintenance and construction projects. This is a truly dire situation. Economists expect a cut of around $2 billion to $3 billion to the state's general fund, which is currently $12.4 billion, and covers core priorities such as K through 12 and higher education, corrections, and critical healthcare and human services programs. Cuts of this magnitude may not spare the institutions that sustain our communities, our schools, and universities. These are the worst cuts we have ever faced, far worse than the cuts made after the Great Recession. That's going to be determined very shortly. As the House and Senate are expected to come back into session on May the 18th, they only have till, I believe it's June the 5th, to determine what the state's budget going forward is going to be. And the JBC, the Joint Budget Committee, has already been working on both remote and in meetings to try to start looking at it. Westminster is just like the state. In about 2 weeks, we will have the revenue forecast and revenue reports coming back in from our businesses. That will then tell us then how bad April was. We already know how bad March was, but keep in mind, March was a very short period where we were under the stay-at-home order. April will be the first full month either the counties, the cities, or the state have seen. So the revenue projections are going to drive everything that happened. In my conversation with some of the members of the Joint Budget Committee, everything that had been sent over to appropriations before the session ended is going to have to go back for review. And that's because of the projected shortfall of revenue in the state. A lot of things that we thought that were going to get approved won't get approved. Things that were approved last year may be cut. This is probably the biggest financial impact to the state that we've seen in many, many decades.
Yeah, and then that's a very good point that you make. You know, Senator Zenzinger has shared a lot of information. I know she sits on the JBC, and so she's in tune with what's going on, and shared across the grid. You know, there is going to be a cut and expect it to be a big one. Now, session reconvenes this Friday for them, and I'm sure timely updates will come as they, you know, assess various things. One of the things I know they're looking at is any measure, and exactly what you shared, Mayor Atchison, whether it's passed or was going to pass, what's the fiscal implication on it? And if it's not directly connected to COVID, then there's not really a need for that to move forward.
I think that's true. And I think that with everything that's happened with COVID-19 is going to drive a lot of things, not only here in the metro area, but statewide. A lot of things that people were planning to do in their municipalities or in their counties. It could be election items, it could be finance items, it could be construction jobs. All of these things are going to have to get reassessed because there's just so much people are willing to put up with during this period of time. Social distancing is important, protecting our workers, our healthcare workers, our first responders, but most importantly, protect yourself. Protect those you work with, protect the people around you and your families. I cannot encourage you strongly enough that if you go out in the public or you're in public sessions, please wear some kind of face covering. I do every time I'm out of the house. My family, I have a couple of people in my family that are high risk, and it's because of their health conditions, not just because of their age. I'm very cautious around being around them to make sure that you wash your hands, you don't touch your face, wear the face coverings. But remember, when we go into critical places, especially things like grocery stores or others where there are considered critical services, be kind enough to respect the people who are serving you to help protect them. They don't want to get sick from you. You don't want to get sick from them. Consider wearing the face covering. If you can't bring yourself to doing that, then ask somebody to go do the shopping for you. I'm not trying to infringe on anyone's rights, but this is just a common courtesy thing to look at. Is we want to protect everybody and keep ourselves healthy. We want to come out of this. This is not going to be an overnight piece. When the time comes to open businesses back up, some, as we said earlier, will make a decision not to open. They just financially can't do it, or they can't open it on a graduated level and still maintain a level of profit. They can't afford to lose anymore. So it's more important that we understand what the process is of how we open, that we do it safely, and we do it in the best way we can to protect and keep as many of the businesses as we have available.
Absolutely. And we've got several other people that hopped on. Jason Mazak, hello. Elizabeth Price, good morning to you. Tina shares, thank you so much for the updates. Your time's very much appreciated. Our chairman, Brian Dice, appreciate these updates from the mayor as things are rapidly changing. Great information. So anything else that you wanted to kind of close off with? I know we're right around the 11:30 mark, but you're always still full of full of information, so I don't want to let you off the hook. So if
No,
there,
I appreciate it, but I think that's probably about enough that anybody can handle for 30 minutes. But again, listen in on the conversation tonight. You'll get more COVID information updates. I'll try to check on the couple of items, especially about our first responders, and see if I can get an update for you there on the call tonight.
That would be terrific. Thank you. And I can send that your way. If you end up watching this video on replay, please give us #replay in the comments and be sure to ask us any questions or comments that you did not have a chance to. Or if you were already tuning into this broadcast this morning and you were hesitant on asking something, but you think about it later, please come back to us. The mayor and I continue to exchange emails throughout the week to address some of those questions and bring you your answers back. So we will be here again for a live tomorrow at 11 a.m. Tomorrow's topic is focused on realty and forbearance. So really looking at the housing market, mortgage, rent, what can we do in the time of COVID? So thank you so much to Mayor Atchison for taking some time this morning to spend it with us, and to each and every one of you for tuning in for a half hour to get an update on what's going on around you. Thank you.
Thanks, Juliet. Have a good day.
You as well.